Next, I'd like to talk about hormones and how they relate to depression. And I'd also like to talk about stress and how it relates to depression, as well as talk about some of the genetics or the predispositions to depression. 20% of people that have major depression have low thyroid hormone. And that leads to low energy, low metabolism in the brain and body. Sometimes a psychiatrist will prescribe thyroid medication to increase thyroid output in people that are depressed, and that will work to relieve the symptoms. So there are certain situations or conditions that can impact the thyroid hormone system and make people more susceptible to depression or make a pre-existing depression worse. And those are things like childbirth. So it's well known that women who give birth can often undergo what's called postpartum depression, and that's thought to be hormonally related, either directly to the thyroid system or perhaps to the cortisol system as well. We'll talk about cortisol in a moment. As well, certain women during certain phases of their menstrual cycle experience symptoms that are very much like clinical depression and oftentimes are diagnosed with clinical depression appropriately. And of course, the menstrual cycle is associated with shifts in hormone levels. As well, menopause and postmenopausal women are more susceptible to major depression, regardless of whether or not they've had that major depression earlier in their life. So these are things to be on the lookout for and to definitely talk to a doctor and get a blood panel that hopefully includes measures of thyroid hormone and cortisol hormone.